Welcome to the Outdoor Emergency Care presentation for Chapter 7, Obtaining a Medical History. Obtaining a history will help us to find clues to assess or diagnose what is wrong with the patient. It may also help us figure out that an unrelated condition may have contributed to the current situation. There may be special considerations that will influence how this particular patient responds to their injury or how they should be treated for it. Asking specific questions about their complaint may help indicate the severity of the current situation. Ask your medical history questions in a thoughtful way to get the most complete and accurate responses possible. Ask each question in an open-ended manner that leads the patient to the answers you are looking for. For example, what medicines do you take? Is an effective way of asking that question. It forces the patient to think about it. Do you take any medicines? Will be quickly answered with a simple no, almost before you finish asking the question. Do you take blood thinners? Is a yes or no question. Let the patient think about the question and answer it. This requires some patience. A rule of thumb is that on average it takes a person 7 seconds to realize that they've been asked a question, think about it, come up with the response, and then actually say it. The older the patient, the longer it's going to take them to answer, and the more medical history they have to think about. When the patient denies something that you've asked them, you can ask narrower, closed-ended questions to rule out that they may have forgotten something. Carefully consider the situation before you ask sensitive questions. Asking a teenage female about the possibility of pregnancy is probably best done out of earshot of the patient's parents. Similarly, asking a patient about alcohol or drug use is probably best done without any law enforcement officers in the room. The mnemonic that we use to obtain a medical history from the patient is SAMPLE, and you are expected to memorize this. SAMPLE stands for signs and symptoms. Are you allergic to anything? Medications. Past medical history. Last oral intake. Events leading up to the injury. To ask the sample questions, starting with S, ask the patient what happened or what hurts. This will give us the chief complaint. The chief complaint will be explored in more detail when we obtain our OPQRST history. A. Are you allergic to anything? We're particularly interested in any medications that they're allergic to, particularly those that they might receive on the ambulance or in the emergency department. We're also interested in any food or environmental allergies that may be related to their current chief complaint. M. What medications do you take? The patient's list of medications will give us important clues to their medical history and to how they may respond to the current illness or injury. P. Past medical history. What medical conditions do you have? We want to know about all possible medical conditions that the patient may have. Avoid asking, do you have any medical conditions we should know about? Because that lets the patient pick and choose. We want to know about everything. L. What have you had to eat or drink today? It's possible the patient may have been exposed to an allergen. Also, we want to know how full is their stomach in case they're prone to vomiting. We'll know what to expect to see coming back up. E. Events leading up to the incident. What were you doing just before this started? Were you feeling okay before you hit the tree? To get more information about the chief complaint, you can ask the OPQRST questions. Not all of these questions apply to every complaint or situation, so these should be considered tools in your toolbox. They are definitely not mandatory. Remember that OPQRST can be used to decipher almost any chief complaint, whether or not the patient is complaining of pain. So avoid asking the word pain in these questions. OPQRST stands for onset, provocation or palliation, quality, radiating or referred, severity, and time. O. Onset. When did this start? Although most complaints in the ski patrol setting start at the time of the fall, it's possible that the patient felt a pop in their knee prior to the fall, or that they were having knee pain earlier in the day. P. Palliation or provocation. Have you done anything that makes it feel better? Have you done anything that made it feel worse? Q. Quality. Can you describe what the sensation feels like? If the patient has difficulty coming up with a descriptor, you can use closed-ended questions like, is it sharp or dull? R. Radiating or referred pain. Does the sensation go anywhere else? And are you feeling the sensation anywhere else in your body? S. Severity. On a scale from 0 to 10, with 10 being the worst, how bad is this sensation right now? T. Time. Has this sensation changed at all since it started? While taking your history, it's a good idea to write down what you learned from the patient. You can do this in a notebook or a piece of scrap paper, or even on a piece of tape stuck to your uniform. If you write down SAMPLE and OPQRST vertically on your piece of paper, then you can go back and fill in the blanks when the conversation wanders or the patient tells you more than you were expecting. And that way you can go back to your acronym, fill in the blanks, and not miss anything when you're done. You can also use this piece of paper for the patient's name, date of birth, and vital signs. Once you're done, transfer the information to your EMS handoff note and to your formal incident report. As you're asking the sample history, you may want to ask certain follow-up questions. For example, when asking about medications, if you hear an unfamiliar medication name, you may want to ask the patient what they take that for. You may also want to ask if they've taken their medications today. If you have any suspicions, you can ask if there's anything the patient is supposed to be taking but isn't. And again, considering the setting and patient confidentiality, you can ask in a calm, non-judgmental manner about any alcohol or recreational drug use. Depending on the situation, you may also want to know, when was the patient's last menstrual period? When was their last bowel movement, and was it normal? Have they been having normal urination? As with the rest of your assessment, you'll want to reassess for changes over time, particularly on the pain score. This is considered a sixth vital sign. If we've splinted or otherwise treated a patient's injury, we want to know if we made it feel better, and hopefully decreased their pain. It's also possible that the patient will remember things that you may have asked about in your sample history, so don't be surprised if the patient tells the aid room attendant or the ambulance crew something that they were not able to tell you on the hill.